Dr. Sarah Chen had been a forensic pathologist for 12 years, but she'd never gotten used to the 3 a.m. calls. Tonight was no different. Her phone buzzed on the nightstand, pulling her from a deep sleep. Dr. Chen, we need you at Memorial Hospital. Suspicious death. The detectives are requesting your presence before we move the body. 20 minutes later, Sarah pushed through the emergency room doors, her credentials clipped to her jacket. The hospital was quieter at this hour, with only the essential staff moving through dimly lit corridors. A young officer directed her to a private room on the 3rd floor. Detective James Parker stood outside, his face grim. Sarah had worked with him on dozens of cases over the years. He was thorough, honest, and one of the few detectives who truly understood the value of forensic evidence. "What do we have?" Sarah asked, pulling on latex gloves. Robert Fitzgerald, 62, prominent real estate developer. Admitted 6 hours ago complaining of severe abdominal pain. Dead 90 minutes later. The attending physician, Dr. Marcus Reed, called it a heart attack and was ready to sign the death certificate. But the nurse who was present during his final moments, she flagged something. Said it didn't look right. Sarah entered the room. The deceased lay on the bed, his face frozen in an expression of agony that seemed inconsistent with cardiac arrest. She began her preliminary examination, noting the dilated pupils, the bluish tint to the lips, the rigidity already setting into the muscles. "Where's the nurse who raised the concern?" Sarah asked. "Getting coffee." She was pretty shaken up. "Name's Jennifer Walsh. Been a nurse here for 8 years. Said she's seen plenty of heart attacks, and this wasn't one." Sarah continued her examination, her trained eye catching details others might miss. The pattern of lividity was wrong. The facial expression suggested acute distress, possibly from respiratory failure or neurotoxic shock. And there, faint bruising around the injection site on the arm that seemed inconsistent with standard foreplacement. "I need a full toxicology screen," Sarah said. "And I need this body transported to my lab immediately. Don't let anyone else near it until we complete the autopsy." Parker nodded, already on his phone arranging the transfer. That's when Dr. Marcus Reed appeared in the doorway. He was in his mid-40s, impeccably dressed even at this hour, with the kind of confidence that came from years of success. He was also the hospital's chief cardiologist and a man whose medical opinions carried enormous weight. "Detective, Dr. Chen," he said smoothly. "I'm not sure why this is necessary. Mr. Fitzgerald presented with classic symptoms of acute myocardial infarction. I treated him appropriately, but unfortunately, his heart couldn't withstand the damage. It's tragic, but hardly suspicious." "Then you won't mind if I conduct a thorough autopsy," Sarah replied evenly. Something flickered in Reed's eyes, annoyance, perhaps, or something else. "Of course not. But I should mention that Mr. Fitzgerald's family is quite prominent. They're grieving. Dragging this out with unnecessary procedures seems cruel when the cause of death is obvious." "Nothing is obvious until I've completed my examination," Sarah said. "The body is being transferred to my facility." Reed's jaw tightened, but he nodded. "As you wish, doctor." After Reed left, Nurse Jennifer Walsh returned. She was in her 30s, with tired eyes but a sharp, intelligent expression. Sarah introduced herself and asked her to describe what she'd witnessed. "Mr. Fitzgerald was stable when I last checked on him at 1:15 a.m., Jennifer said. "Uncomfortable, yes, but stable. His vitals were holding. Then Dr. Reed came in around 1:30. I thought it was strange because he wasn't the attending physician. He said he'd heard about the case and wanted to check on Mr. Fitzgerald personally since they were old friends." "Go on," Sarah encouraged. "Dr. Reed asked me to prepare an injection. He said it was a stronger pain medication. I prepared it from a vial he provided. He administered it himself, which also struck me as odd. Normally, we nurses handle injections. Within 5 minutes, Mr. Fitzgerald started seizing. His breathing became erratic. Dr. Reed called a code, but Jennifer's voice cracked. It was like he wasn't really trying, like he was going through the motions. Mr. Fitzgerald was dead within 10 minutes. Dr. Marcus Reed appeared in the doorway. He was in his mid-40s, impeccably dressed even at this hour, with the kind of confidence that came from years of success. He was also the hospital's chief cardiologist and a man whose medical opinions carried enormous weight. Dr. Reed asked me to prepare an injection. He said it was a stronger pain medication. He administered it himself, which also struck me as odd. Normally, we nurses handle injections. Did you keep the vial Dr. Reed used? Sarah asked. Jennifer reached into her pocket and pulled out a small glass vial. I palmed it during the chaos. I don't know why, instinct I guess. Something just felt wrong. The nurse looked relieved but frightened. Dr. Reed is powerful here. If I'm wrong about this, if I've just destroyed an innocent man's reputation over a feeling. You're not wrong, Sarah said quietly. Trust your instincts. 6 hours later, in her lab, Sarah began the autopsy with her assistant, Tom, documenting every step. What she found confirmed her suspicions and turned a suspicious death into a homicide investigation. Robert Fitzgerald hadn't died of a heart attack. He died of acute poisoning, specifically a massive dose of potassium chloride administered intravenously. In high concentrations, it caused cardiac arrest that could mimic a natural heart attack, especially if the administering physician controlled the narrative. The vial Jennifer had saved contained traces of the same substance, far exceeding any therapeutic dose. Sarah immediately called Detective Parker. It's murder, she said without preamble. Potassium chloride poisoning, deliberately administered. The vial the nurse saved, it's evidence of intentional overdose. Dr. Reed, Parker said grimly. Everything points to him, but we need to understand motive. A respected cardiologist doesn't just murder a patient without reason. Parker was quiet for a moment. I'll dig into the connection between Reed and Fitzgerald. There has to be something. What Parker discovered over the next 48 hours painted a damning picture. 10 years earlier, Dr. Marcus Reed had been involved in a real estate investment scheme with Robert Fitzgerald. Reed had invested nearly everything he had, his savings, his children's college funds, money borrowed against his home. Fitzgerald had promised guaranteed returns on a luxury condo development. The development had failed spectacularly. Investors lost millions. Fitzgerald, protected by clever legal structures and LLC shields, had emerged financially intact. Reed had lost everything and spent years rebuilding his life. The bankruptcy had destroyed his first marriage and damaged his relationship with his children. 3 months ago, Fitzgerald had announced plans for a new development, the biggest of his career, projected to make him hundreds of millions. For Reed, watching the man who destroyed his life prepare for a massive windfall must have been unbearable. We have motive and evidence, Parker said, but we need to move carefully. Reed has lawyers, connections, and a sterling reputation. We get one shot at this. The arrest came on a Tuesday morning. Dr. Marcus Reed was in the middle of hospital rounds when detectives arrived with a warrant. The shock on his face quickly morphed into indignant rage. This is absurd. I'm a doctor. I save lives. Robert was my patient, and I did everything possible to help him. You administered a lethal dose of potassium chloride, Parker said calmly. We have the vial, we have the autopsy results, and we have a witness who watched you do it. We also know about the investment scheme 10 years ago. We know what Fitzgerald cost you. Reed's face went pale. You can't prove anything. It was a medical emergency. I was trying to save him. Then why did you use medication from an unmarked vial instead of hospital stock? Why did you administer it yourself instead of letting the nurse do it? Why did Nurse Walsh observe you watching Mr. Fitzgerald die without genuine attempts at resuscitation? Reed said nothing, his lawyer already whispering urgently in his ear. The trial began 4 months later. The prosecution's case was methodical and devastating. Sarah testified about the autopsy findings, explaining in clear terms how potassium chloride poisoning worked and why Fitzgerald's death was inconsistent with natural causes. Jennifer Walsh testified about Reed's suspicious behavior and the unmarked vial. Financial experts detailed Reed's decade-old grudge and his mounting debts despite his successful practice. The defense tried to paint Reed as a dedicated doctor who'd made a desperate attempt to save a dying patient, arguing that in the chaos of a medical emergency, proper protocols had been overlooked. They suggested the potassium chloride had been a legitimate medication kept in Reed's personal supply and that any overdose was accidental. But the evidence was overwhelming. The jury deliberated for less than 6 hours. Guilty of first-degree murder. At sentencing, the judge showed no mercy. Dr. Reed, you held a position of profound trust. Patients came to you believing you would heal them, not harm them. You violated that trust in the most heinous way possible, using your medical knowledge to commit murder. You calculated that your expertise would allow you to disguise murder as natural death. You nearly succeeded. If not for the diligence of Nurse Walsh and Dr. Chen, you would have. The judge sentenced Reed to life in prison without possibility of parole. After the sentencing, Sarah found Jennifer Walsh in the courthouse hallway. The nurse looked exhausted but relieved. "Thank you," Jennifer said, "for believing me, for trusting that what I saw was real." "You saved this case," Sarah replied. "Your instincts, your courage to speak up despite the risk to your career, that's what brought a killer to justice." "You spoke up when it mattered most," Sarah said. "That's what counts." Later, alone in her office, Sarah reflected on the case. If Jennifer hadn't trusted her instincts, if Sarah hadn't pushed for a full autopsy despite Reed's protests, if the detectives hadn't thoroughly investigated the connection between victim and killer, Reed would still be practicing medicine, still be in a position to harm others. Evil flourished in silence, in the moments when good people chose convenience over conscience, when they deferred to authority instead of trusting their instincts. 6 months after Reed's conviction, Sarah received a letter from Fitzgerald's daughter. "Dr. Chen, my father wasn't a perfect man. The business dealings that led to Dr. Reed's hatred, Dad did ruin people's lives with his schemes, even if he never faced legal consequences. I've spent months grappling with complicated grief, mourning a father I loved while acknowledging the harm he caused. But he didn't deserve to be murdered. No one does. And his death would have been swept under the rug, classified as natural, if not for you and Nurse Walsh. You gave our family truth, even when that truth was painful. You ensured that a man who violated the most sacred trust, a doctor's oath to do no harm, faced justice. Thank you for your integrity, your expertise, and your refusal to accept easy answers." Sarah kept that letter in her desk drawer. On difficult days, when she felt overwhelmed by the darkness her job exposed her to, she would read it and remember why her work mattered. Justice wasn't just about laws and evidence. It was about people choosing to do the right thing when it would have been easier to look away. It was about nurses trusting their instincts despite hierarchies. It was about pathologists insisting on thoroughness despite pressure. It was about all the small acts of integrity that, together, formed an unbreakable chain holding back chaos. Dr. Marcus Reed had believed he was clever enough to commit the perfect crime, that his position and knowledge would shield him from consequences. He'd forgotten that justice didn't rely on any single person. It relied on a system of checks and balances, on professionals who took their oaths seriously, on ordinary people who found extraordinary courage. In the end, Reed's greatest mistake wasn't the murder itself. It was his assumption that no one would care enough to look closely, to question, to fight for truth. He'd underestimated the silent witnesses who saw everything and refused to stay silent. And that had made all the difference.